Well, thank you, Madam Chairwoman, Ranking Member. This is it's a very important topic in terms of health care. Actually, a number of the witnesses are, I represent that part of Pennsylvania adjoining Mrs. Dahlkemper, so it's up in the rural part of Pennsylvania. And having come out of health care, working 28 years in health care, actually, my health system engaged in a somewhat painful process years ago with health information technology as a beta program. Wouldn't recommend that to anyone, actually, because that's where you work all the bugs out. But it certainly has been a good move. I have some questions. I was interested representing a very rural area. What's your experience been with interconnectivity? I mean, it's one thing to invest in infrastructure within the facilities, within the bricks and mortar, for the practices that you represent, or the hospitals or the healthcare facilities, but networking them for the greatest efficiency in terms of communication, especially in rural America. Any thoughts, reflections on how prepared are we with interconnectivity? Now open that up to anyone in the panel, please.
Chairwoman Dahlkemper, if you don't mind, and Mr. Thompson, I would like to respond. Actually, the stimulus, the ARA provisions actually have language in there and opportunities for increasing broadband activities. And in Georgia, one of the things that our Governor, Sonny Perdue, has done is required all of the agencies that are eligible for stimulus funding to meet on a weekly basis to ensure that we drive any dollar towards an end point that can be sustained by the state once these funds are no longer available, and then meet the best interest. One of those work groups is around broadband adoption, ensuring that if we have a broadband initiative, that it's used to expand the bandwidth for rural providers who want to adopt HIT from the HITECH Act. It's almost, he's required us to say, if you're going to do this, we're going to make sure that we get the bandwidth in the rural communities and we maximize that opportunity. And so I think one of the opportunities that all of the states should look at is how you intersect and pretty much force some collaboration between education, health, and technology, so that you're not building 5 or 6 we call them T1 lines, when you only really need one to meet the needs of the people who are out in the rural community, whether it's health or education or safety.
Anyone else with a perspective or experience with interconnectivity?
Yes. From the perspective of home and community-based care, which is about as dispersed as it gets, interconnectivity to me is the key issue in all of this. Is what we're trying to really create is a network where every user who joins benefits the whole. As long as we're just simply digitizing little silos, a doctor's office here, a hospital here, and they don't talk to each other, we're really not accomplishing all that much. And so establishing standards, as Dr. Cressley pointed out, there are some standards that are existing already. Continual Health Alliance has recently published their standards that are a great first step to creating that interconnectivity. So anything that the federal government can do to push standards quicker, to get that groundwork laid, will really help with the adoption.
I'm sorry. Go ahead, Dr. Cressley.
One of the things I wanted to say, being from rural PA, the standards and implementation are there, but there's also has to be resources, because the small businesses and the rural practices and the primary care physicians don't have a lot of resources to help write the other piece of the interface. For example, my local hospital offered to help with health information technology for the primary care people in the region. But they decided that they picked the vendor, which was not friendly for pediatricians and other resources. And so some people went out and got their own EMR, which actually is pediatric friendly. But the hospital won't turn on the spigot to let the information go both ways, even though I have the technology to do it. And there's no way, as a pediatrician, we can afford to add that additional cost of interoperability. So I would say that sort of greasing the wheels between the two interoperable sites needs to come from funding from somewhere else, whether it's the state level or used at the interoperability that Dr. Blumenthal was talking about this morning. It needs to come from somewhere else, because it's going to make make it much harder for the smaller independent physician groups when there are big players in the arena who can afford their end and decide they want to push what they want as their agenda, but it freezes out some of the smaller uses of technology which need to be supported. Believe it or not, in Warren, PA, a colleague of mine just bought an EHR, and he was able to input all the data from the Pennsylvania State Registry as part of a pilot project. So all the immunization data that he's been entering for the last 15 years by implementing his EHR came back to him in electronic format. But that's a pilot, and Pennsylvania State can't afford, doesn't have the resources to make that a more statewide global initiative. So we're starting pilot projects, but we need resources. The standards are being written. We can't wait for standards to all be finalized to start implementing. Again, the horse is out of the barn and the technology is moving ahead. We need to make sure that the resources put a level playing field for the small independent practices and people in specialties who are not represented nationally in all the work groups.
Well, and I think you hit on a real practical issue. It's been my most recent experience before coming here was an electronic medical record, specifically in a skilled nursing setting, which was great for nursing, but had absolutely no application for the physician part, for the rehabilitation part, for other aspects. It's I think that's a challenge as we are now spending a lot of money in investing, and I look at it as a good investment, but there's not a lot of products out there that will handle the comprehensiveness, the continuum within all the respective healthcare settings. Thank you, Madam Chair.